Ketogenic diets can certainly lower blood sugars, better than conventional diets, so much so there's a keto product company that claims ketogenic diets can reverse diabetes. But they are confusing the symptom, high blood sugars, with the disease, which is carbohydrate intolerance. People with diabetes can't properly handle carbohydrates, and this manifests as high blood sugars. Sure, if you stick to eating mostly fat, your blood sugars will stay low, but you may actually be making the underlying disease worse at the same time. We've known for nearly a century that if you put people on a ketogenic diet, their carbohydrate intolerance can skyrocket within just 2 days. Here's the blood sugar response of someone eating sugar after 2 days eating a high-carb diet. Here's exposure to the same amount of sugar after a high-fat diet for 2 days. Their intolerance to carbohydrates skyrocketed on a high-fat diet. 1 week on a 80% fat diet, you can quintuple your blood sugar spike in reaction to the same carb load compared to a week on a low-fat diet. Even a single day of excessive dietary fat intake can do it. If you're going in for a diabetes test, having a fatty dinner the night before can adversely affect your results. One meal high in saturated fat can make the cause of diabetes, carbohydrate intolerance, worse within 4 hours. Now, with enough weight loss by any means, whether from cholera or bariatric surgery, type 2 diabetes can be reversed, but a keto diet for diabetes may not just be papering over the cracks, but actively throwing fuel on the fire. I've been trying to think of a good metaphor. It's easy to come up with things that just treat the symptoms without helping the underlying disease, like giving someone with pneumonia aspirin for their fever instead of antibiotics. But a keto diet for diabetes is worse than that, because it may treat the symptoms while actively worsening the disease. So maybe it's more like curing the fever by throwing that pneumonia patient out into a snowbank, or maybe curing your amputated finger by amputating your hand. No more unsightly finger stub. One of the co-founders of masteringdiabetes.org suggested it's like a CEO that makes their bad bottom line look better by just borrowing tons of new cash. The outer numbers look better, but on the inside, the company's just digging itself a deeper hole. Remember The Club? Maybe I just watched too much late-night TV growing up, but it's a car anti-theft device that attaches to your steering wheel and locks it in place, so the steering column can only turn a few inches. Imagine you're in a car at the top of a hill with the steering wheel locked. Then the car starts rolling down the hill. What do? Oh, did I mention there's also something stuck under your brake pedal, too? The keto diet equivalent response to this situation is, who cares if you're barreling down into traffic with no brakes and a locked steering wheel? Just stick to really straight, deserted roads without any stop signs or traffic lights. If you do that, problem solved. Yeah, the longer you go, the more speed you'll pick up, and so if you should hit a dietary bump in the road or start to veer off the path, the consequences could get more and more disastrous with time, but if you stick to the keto straight and narrow, you'll be A-OK. In contrast, the non-keto response would be to just unlock the steering wheel and dislodge whatever's under your brake. In other words, fix the underlying problem instead of just whistling past and then into the graveyard. The reason keto proponents claim they can quote-unquote reverse diabetes is that they can successfully wean type 2 diabetics off their insulin. But that's like faith healing someone out of the need for a wheelchair by making them lie in bed the rest of their lives. No need for a wheelchair if you never move. Their carbohydrate intolerance isn't gone, their diabetes isn't gone. It could be as bad or even worse. Type 2 diabetes is reversed when you can wean people off insulin eating a normal diet like everybody else. Then and only then do you not have diabetes anymore. A true diabetes reversal diet is practically the opposite of a ketogenic diet. Diabetics off their insulin within a matter of weeks, eating more than 300 grams of carbs a day. The irony doesn't stop there. One of the reasons diabetics suffer such nerve and artery damage is due to an inflammatory metabolic toxin known as methylglyoxal that forms at high blood sugar levels. Methylglyoxal is the most potent creator of advanced glycation end products, the so-called AGEs, which are implicated in degenerative disease from Alzheimer's disease and cataracts to kidney disease and strokes. You get AGEs in your body from two sources, eating them preformed in your diet or making them internally from methylglyoxal if you have high blood sugar levels. On a keto diet, one would expect high exposure to preformed AGEs, since they're found concentrated in animal-derived foods high in fat and protein, but we would expect less internal new formation due to presumably low levels of methylglyoxal, given lower blood sugars not eating carbs. Dartmouth researchers were surprised to find more methylglyoxal, though. A few weeks on the Atkins diet led to a significant increase in methylglyoxal levels. And those in active ketosis did even worse, doubling the level of this glycotoxin in their bloodstream. It turns out high sugars may not be the only way to create this toxin. One of the ketones you make on a ketogenic diet is acetone, known for its starring role in nail polish remover. Acetone does more than just make keto dieters fail breathalyzer tests and develop what's been described as rotten apple breath. Acetone can oxidize in the blood to acetol, which may be a precursor for methylglyoxal. That may be why keto dieters can end up with levels of this glycotoxin as high as those with out-of-control diabetes, which can cause the nerve damage and blood vessel damage you see in diabetics. That's another way keto dieters can end up with a heart attack. So the irony of treating diabetes with a keto diet may extend beyond just making the underlying diabetes worse, but by mimicking some of the disease's dire consequences.
I'm Dr. Anthony Gustin, and I'm here to tell you the difference between keto and ketoacidosis. One is a normal metabolic state, and one is something that's seriously life-threatening. And so keto is not dangerous, and it will not kill you. There's been a lot of confusion. It's been getting easier now, but when somebody says keto, maybe to a doctor or a nurse or anybody who has type 1 diabetes, they think, oh my God, emergency, let's go to the hospital. And so they're actually thinking of a state called ketoacidosis. And so if you measure your ketone levels in your blood, a normal state of ketosis, you're at 1.2, 1.5 millimolars, is how you measure ketones in your bloodstream, even up to 4, 5, 6. But when we're looking at ketoacidosis, your levels are at 20 plus. So the good news is that if your pancreas works at all like it should, it's actually physiologically impossible for you to be in a state of ketoacidosis. Why is that? Because you'll have little bits of insulin that will be secreted, and your body will have a tightly regulated metabolism that is able to keep the ketones in a very stable amount. And so your blood glucose will be regulated, and your ketone levels will be regulated, and everything will be exactly what your body needs at whatever given time. It's literally impossible if you have a normal functioning pancreas, and I'll say this again, if you do not have a destroyed pancreas, you cannot have ketoacidosis. So where this does come into play and why people are confused about it is it's a medical condition. So type 1 diabetics, their pancreas, what happens is that it's so destroyed that it doesn't produce insulin. And so what happens is that you start getting this dysregulation of glucose versus ketones, and the ketones get so out of whack that your body actually creates this acidic state that can be really, really damaging for a lot of different cells and organ systems. Not good. So that is a problem. Also, if you're in a late stage type 2 diabetic, so ketogenic diet can be great for treating diabetes and reversing that, but if you're really late stage, you probably need to watch out a little bit and make sure you monitor that with your doctor to make sure that you're not getting ketone levels super, super, super high. So maybe a follow-up question is, can type 1 diabetics do a ketogenic diet? Again, please titrate your insulin levels with your doctor, but a lot of type 1 diabetics have been able to manage their condition really, really easily with a ketogenic diet, and it's not like a ketogenic diet immediately puts them in a state of ketoacidosis. So those two things are very, very different. So one is a state, normal metabolic process, that you just start using fat for energy. Again, if you have a normal functioning pancreas, you'll know that or not, then you have nothing to worry about. Ketoacidosis, not a great thing. If you have a dysfunctional pancreas, you're gonna know that. So if you have type 1 diabetes or type 2 late stage diabetes, you should be aware of this and make sure that you know the symptoms, signs, and everything like that, so that way you can get the help you need if that becomes a problem. So if you have any questions about keto versus ketoacidosis, leave them in the comments below or send me a message on Instagram. I answer every single one of those. So Dr. Anthony Gusson on there, and we will see you guys next time.
Can keto diet cure diabetes? No. No, 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 with a side order of no. But can it manage it? Sensational! Hey kids and kittens, I'm Duggan. Welcome back to another awesome car vlog commentary type thingy bob. I have yet to figure out what these are meant to be called. I'm going to ask you to hit that like button and share across the interwebs, because Dr. Duggan has decreed that obviously keto diet cannot cure diabetes. There are certain other side effects to it that I will not be looking at today, but I'm looking at the curing of diabetes. Myth or actual not myth? Now, let's backtrack a little bit. What is diabetes? It is a metabolic disorder affecting how, well, I'll say humans, but how the body manages the sugar within the bloodstream. Usually to the point, obviously, it's got an excessive amount of sugar in the blood system. Generally subcategorized into two types. There is the type 1, which is insulin non-production. The pancreas is just not producing insulin. Widely accepted, this is an autoimmune response, so basically the body's killed the pancreas for reasons we have not as yet been able to identify. In theory, pancreas transplant should work. It's been a lifetime of anti-rejection drugs. So hence the next best thing, and less complications, obviously, having the anti-rejection drugs, insulin injections. And these days, it's synthetic insulin, as opposed to when in the 1920s we actually crushed up human pancreases. What the fuck? But the more prevalent version, type 2 diabetes, commonly referred to as insulin resistance, usually happens later on in life. The body is able to produce insulin, the body is just less receptive to insulin, leaving an excess of blood sugars floating through your system. So hence, the statement obviously, keto diet curing diabetes, no. It's part of dietary management to help bring the excess sugar into the system down as low as possible. Basically, avoid by cutting out carbs. You then ultimately relying upon your body converting protein into energy. This isn't as an efficient mechanism of fuel consumption. Years and years and years ago, humans literally lived from meal to meal. They literally survived on. Okay, as I hide myself here. Humans literally lived by the skin of their teeth, seat of their pants, whatever you want to call it there, and hence having a very efficient system to assume and consume all the nutrients as much as you physically needed was very desirable for the body to do. These days, with processed foods left, right and centre, there's an abundance of free energy, and hence why obesity and other excessive weight disorders are rising. Along with it, type 2 diabetes. More scarily is the new subdivision, which is type 2 diabetes young. So anybody under the age of 40 who has been diagnosed with type 2 diabetes are much more likely to get more serious complications arising from diabetes. Now, these would fall in the category of both micro and macular vascular changes. We'd also see, heart disease, elevated blood pressure, kidney failure to a certain extent, nerve damage. What else? There's a whole list of things that diabetes really fucks up. And we can put the blame squarely on us humans being lazy fucks, not exercise as much as we should do, and eating too much. It is literally a basic calories in versus calories out argument. Now, part of the reason why I'm educating you about this, I've seen too many times the myth that keto cures diabetes. No, it'll help manage it, but I would not trust keto diet to manage a type 1 diabetic. They're going to need insulin for life, or pancreas transplant. Why do I know all this? Because, as an optometrist, I've been learning about diabetic eye disease as part of a diabetic retinopathy screening program that we run here in Greater Manchester, which, ironically, we've also lost the contract rights for as well, but that's a different story for a different day there. Amongst this, I need to know about diabetes. I would have thought that was overkill myself. I need to know about diabetic eye disease, which I have done for the last 14 years. Plus, my understanding of diabetes was rudimentary. Suffice to say, after going through this course to participate in the diabetic retinopathy program, my knowledge of diabetes and associated screening programs has skyrocketed. So feel free to ask me anything in the comment section below about diabetes, diabetic eye disease, or even the eyes. I'll answer them, and if it's obviously a controversial or your personal nature, don't be afraid to email me. It is justduggan@gmail.com. Otherwise, I'm Duggan. Hard exit. Almost as hard as Brexit, but we're not going to see that anytime soon. Hit or miss? I get never miss.